These days we have a ton of different ways to treat psychological issues, everything from talk therapy to medication. But with all those choices, how do we actually know if any of them are working? Well, in this explainer, we're going to pull back the curtain and look at the real science of healing the mind.
So, to get a feel for this, let's imagine someone, we'll call her Bernice. Let's say Bernice is dealing with some serious depression and anxiety. If she starts seeing a therapist, how do we know if it's helping? Is it just about her feeling better? Is it about her being able to get back to her life? This isn't just a question for Bernice. It's really the central challenge for the entire field of psychology.
And that's the heart of the problem, right? When you break your arm, you can look at an X-ray and literally see the bone knitting itself back together. It's clear. It's objective. But healing a mind? That's so much more complicated. The improvements happen on the inside. They're subjective, and measuring them with any real certainty is incredibly tricky. Okay, so how do psychologists get around this huge measurement problem? Well, they have to look at two totally different kinds of evidence, what people feel is happening versus what the hard data can actually prove. Let's break that down.
So on one side, you've got subjective perceptions. We can just ask people how they feel, and honestly, the answers are usually pretty positive. One huge study found that 89% of people were fairly well satisfied with their therapy. But you gotta be careful with that. Clients want to believe it's working, right? And therapists are obviously rooting for their patient's success. Plus, they almost never find out if someone relapses a few years down the road.
And this is where science comes in with a really clever tool to get past all those biases. It's called the Randomized Clinical Trial, or RCT. It's pretty much the gold standard for this kind of research. By randomly putting people into either a group that gets the therapy or a control group that doesn't, scientists can isolate the treatment's effect. It's the best way to know if the therapy itself is what's really making the difference.
Now, this brings us to two really important words you'll hear all the time in this field: effectiveness and efficacy. Effectiveness is pretty simple. Does it actually work out there in the messy, complicated real world? Efficacy, on the other hand, is more specific. Does it work better than nothing or better than another therapy under perfect, controlled lab conditions? You absolutely need both to get the full picture of what the research is telling us.
Okay, so now that we've got a handle on how we measure if something works, let's dive into one of the most powerful toolkits we have, biomedical therapies. These are the treatments that aim to physically change how the brain functions.
Now, we absolutely know that talk therapy works. It can give people hope, a totally new way of looking at their problems, and a real trusting relationship. But it's often combined with the biomedical tools we're about to talk about to get an even bigger impact.
The most common biomedical treatment, of course, is medication. Most of these drugs fall into four main buckets. You've got antipsychotics for really severe thought disorders, anxiolytics, which are your anti-anxiety meds, antidepressants, which you've probably heard of, and mood stabilizers for conditions like bipolar disorder.
Let's zoom in on one of the most common types out there, antidepressants like Zoloft or Prozac. A lot of these are what we call SSRIs, which stands for selective serotonin reuptake inhibitors. Here's the basic idea of how they work. Normally, your brain cells release a mood chemical called serotonin, and then they quickly suck the extra back up. What an SSRI does is it partially blocks that reuptake process. This leaves more serotonin hanging around in the gap between your brain cells, which is thought to help lift and stabilize your mood. Pretty cool, huh?
But here's a really important reality check. While these drugs can be incredibly powerful, a lot of research shows that for people with mild to moderate symptoms, medication often works no better than good old-fashioned psychotherapy. Some studies even show it's no better than a placebo in those cases. It just goes to show why digging into the root causes of our problems with therapy is so important, often right alongside medication.
But then, there are situations where the right medication is, well, it's nothing short of a miracle. For people with bipolar disorder, mood stabilizers, like simple lithium salts, aren't just helpful. They can be profoundly life-changing. They can smooth out those dangerous highs and the crushing lows of the condition.
And you absolutely do not have to take my word for it. Just listen to this from Dr. Kay Redfield Jamison. She's a top psychologist who actually has bipolar disorder herself. She says lithium prevents my disastrous highs, diminishes my depressions, keeps me out of a hospital and alive. Wow. That says it all, doesn't it?
But drugs aren't the only tool in the biomedical box. Some therapies are designed to rewire the brain even more directly, using things like electrical currents or magnetic fields to treat the most severe psychological disorders.
Okay, let's talk about electroshock therapy. And I know what you might be thinking. That term brings up all these dark, scary images from old movies. But I need you to hear me out.
The modern version of this has made a huge comeback for one very simple reason. It can be unbelievably effective when nothing else is working. Today, it's called electroconvulsive therapy, or ECT. The patient is put under anesthesia, and a very brief, controlled electrical current is passed through the brain. It causes a tiny, controlled seizure. Now, we're still not 100% sure why it works, but one of the leading theories is that it's like a hard reboot for a severely depressed brain. It seems to kickstart the brain's neurotransmitters back into action.
And ECT is just one of these brain stimulation techniques. If you think about how invasive they are, it kind of falls right in the middle. It's more intense than some newer magnetic therapies, but less intense than some of the surgical options.
So what are some of those other options? Well, you've got something called repetitive transcranial magnetic stimulation, or RTMS, which is much gentler and uses painless magnetic pulses on the scalp. Then on the other end of the spectrum, you have deep brain stimulation, or DBS. This is a lot more invasive. It's basically a surgically implanted pacemaker for the brain that sends electrical pulses to very specific areas.
All right, with all of these futuristic, high-tech tools, it's actually really easy to forget something important. Some of the most powerful things we can do for our mental health don't require a doctor's office at all. They're things that every single one of us can build into our daily lives.
30 to 60. What is that? Well, that is the number of minutes of daily aerobic exercise that studies have shown can be just as effective as antidepressants for treating mild depression. Think about that. It's a simple lifestyle change, but it is so powerful. And of course, exercise is just one piece of the bigger picture. Our minds and our bodies are not separate things. They're completely connected. Our mental health absolutely depends on getting enough sleep, having real social connections, and eating well. This stuff isn't just a nice bonus, it's a fundamental part of our mental well-being.
There's this old English proverb that I think just sums this whole thing up perfectly. Different sores have different selves. There is no one-size-fits-all magic bullet for healing the mind. What works amazingly for one person might not do a thing for someone else. Real, effective treatment is almost always a personalized mix of therapy, maybe some biomedical help, and a foundation of healthy living.
And all of this leaves us with a pretty deep question to chew on. If we can treat our most profound psychological struggles by literally changing our brain's chemistry and its wiring, what does that tell us about the connection between our biology and our very sense of who we are?